All right, this is a 6-week-old gray fox that was presented to us through St. Francis Wildlife, who came into them with a limping and a non-use of one of the rear legs. We radiographed the fox and showed that we do have a distal femur fracture. So the end of the femur bone has been broken, highly displaced as well. We're going to attempt to go in and surgically repair this today, hopefully to be able to release this little guy back to the wild. Here are the x-rays of the gray fox. A lateral shot, as you can see, we have a badly displaced distal femur fracture. We're going to attempt to reduce this and stabilize it in this young pup. Here's the other view. Same fracture. Off to surgery. So we're starting the fracture repair on the little fox. We have him prepped for surgery, and I've just made the incision. As you can see, we've got the very end of the fracture bone exposed simply by a skin incision. So we're going to make a further attempt here to stabilize and repair and reduce this fracture, and we'll come back and take another look in just a minute. That's good. So we've got the fracture pieces aligned, and as you can see here, we've got one pin so far going through the distal piece into the proximal piece, and you can see the fracture site lies right about here. It's reduced very nicely for us, and our goal now is to put another one on this side and run it up the shaft of the bone, and essentially in the bone the pins will cross and be lying something similar to this. At least that's the way we hope it turns out. So our little girl made it through surgery. Kathy's removing her bandage wrap on her back leg. Things went well, and hopefully she'll make a full recovery with this. Hey, sleepy? Someone's a little groggy. Here are the post-op pictures. You can see we got the fracture reduced. There's the two pins. They ended up crossing and coming out of the top of the bone versus being inside. But in a patient of this size, we got very good stability. This should work beautifully. Here's the side shot as well.